Urologist. Masturbation secrets old men wish they knew sooner, advice for elderly. The problem is not age, Dr. Ritika Sharma said, leaning back in her chair. It's what age makes us believe about ourselves. She was in her early 50s, a highly respected urologist who had spent more than 2 decades helping men of all ages, from young adults nervous about their first checkup to veterans in their 80s who whispered about private problems as if they were confessing a crime. On that afternoon, her patient, 74-year-old Mr. Rahman, shifted uncomfortably in his seat. His blood pressure had been checked, his cholesterol was fine, but there was a question he'd clearly been holding on to for years. Doctor, at my age, is it still okay to, touch myself? Dr. Ritika gave a reassuring smile. Let me tell you something, Mr. Rahman. The biggest mistake older men make is thinking that sexual pleasure has an expiry date. It doesn't. Then she began to share what she called the masturbation secrets old men wish they knew sooner. 1. Your body still belongs to you even at 70 or 80. One of the most heartbreaking patterns Dr. Ritika saw in her clinic was men over 60 quietly giving up on their sexual selves. Some had lost their partners, others were in marriages where intimacy had faded, and many had absorbed the idea that desire in old age was somehow inappropriate. When you stop touching yourself, she explained, you stop communicating with your own body, and the body stops responding. Even light self-stimulation sends fresh blood to the penis, which helps maintain tissue health and elasticity. Without that, the area can lose function much like any muscle that isn't exercised. 2. Masturbation is exercise for your sexual health. Dr. Ritika compared masturbation for elderly men to gentle stretching or yoga. It keeps things working. When a man becomes aroused, blood flow increases, oxygenating the tissues and reducing the risk of fibrosis, hardening of tissue that can affect erections. It also triggers the release of nitric oxide, which is essential for erectile function. On the emotional side, masturbation stimulates dopamine and oxytocin, both of which can improve mood and reduce feelings of loneliness. Think of it as part of your health routine, she told her patients. Just like a daily walk, but for your intimate health. 3. It's different from your youth, and that's okay. A big reason some men stop is frustration. Erections take longer, aren't as firm, orgasms feel less intense, and recovery time is slower. Dr. Ritika encouraged acceptance. The goal now is not to rush to the finish line but to enjoy the journey. Her practical tips. Take more time. Older bodies respond better to slow, patient touch. Explore other areas. The perineum, inner thighs, and chest can add to arousal. Use lubrication. Skin gets drier with age, and lubrication can make the experience more comfortable. Experiment with positions. Lying on the side or soaking in a warm bath can help with blood flow. 4. Regular ejaculation can support prostate health. The prostate benefits from regular release. Ejaculation helps flush out fluids that could otherwise contribute to discomfort or inflammation. For those with mild benign prostatic hyperplasia, BPH, regular emptying may improve urinary flow and reduce that heavy, congested feeling. It's like flushing the plumbing, Dr. Ritika said with a smile. Keeps things flowing smoothly. 5. Touch can be a remedy for loneliness. For men who have lost their partners, sexual touch is often more about intimacy than just release. Self-pleasure can become an act of self-connection, a reminder that you are still alive and worthy of touch. Dr. Ritika sometimes suggested combining sexual touch with gentle stroking over the arms, chest, or face, turning the experience into a form of self-compassion. Your touch can be a friend, she told Mr. Rahman, and friends don't disappear with age. 6. Why stopping completely can backfire. When an older man gives up sexual activity completely, the body and mind can suffer. Erections become weaker or disappear altogether. Testosterone may drop, impacting mood, muscle strength, and even memory. Emotional withdrawal can lead to faster physical decline. Dr. Ritika called masturbation preventive maintenance for a man's sexual health, especially after decades of regular activity. 7. Guilt does more harm than masturbation. Some elderly men struggle with religious or cultural guilt about masturbation. Dr. Ritika never dismissed these feelings, but encouraged her patients to view the act through a health lens. Too much of anything can harm you, she said, but a balanced, mindful practice can keep you healthier for longer. She framed it as a self-care ritual rather than a secret shame. 8. Keeping it healthy. Her advice for older men. 1. Stay hydrated. Blood flow depends on good hydration. 2. Warm up. Light exercise or a warm shower before can make a big difference. 3. Set the scene. Privacy, soft light, and comfort make it more relaxing. 4. Take your time. Let arousal build slowly. 5. Pay attention to your body. Stop if you feel pain or strain. 9. Better late than never. When Dr. Ritika finished, Mr. Rahman looked almost embarrassed but also relieved. Doctor, if I had known this in my 60s, I wouldn't have spent so many lonely years thinking something was wrong with me. She smiled. Mr. Rahman, your body hasn't abandoned you. It's been waiting for you to listen. Final words from Dr. Ritika. Pleasure is not the property of the young. It's a language your body speaks for as long as it's alive. The day you stop listening to it is the day you start aging for real. Hit that subscribe button and join us on a journey through the timeless wisdom of the older generation. Don't miss a single life-changing lesson.